to invite our president, Amani Messiah DeGane, to welcome everyone and start our conversation tonight. Amani.
Thank you, Mary. As Mary mentioned, this webinar series, Conversations on Mental Health, started as a result of a survey that New York State PTA sent out to parents and caregivers, asking them to rank the mental health issues among children and youth of their highest concern. In the same surveys, parents also asked us and expressed their interest for more support around mental health conversations with their children and their youth children. They needed support, how to open these difficult conversations and how to conduct them. And we answered the call, and I'm really proud and thankful to our mental health task force led by Pat Janko for the great work they have done over the past almost 2 years now in this area, and bringing these very informative webinars to our parents. And so I'm really thankful and grateful for all your great work and the work that you continue to do. And also thrilled to welcome Dr. Thengam Palal. Thank you so much for taking the time to be with us this evening and sharing your great expertise and your valuable information that you're going to share with us, and excited about the partnership with the New York State Office of Mental Health as well, that is ongoing and will be ongoing in the next few years. So without further ado, I take it back to Mary.
Thank you. Thank you, Amani, for those heartfelt words of support and encouragement. Before we begin this evening's conversation, I want to state that this webinar series is in no way a substitute for professional help. The purpose of this webinar is to open the dialogue with parents, teachers, caregivers, and students on the mental health issues facing us all today, how we can identify certain concerns and ask for help. Let's start this evening off as we engage in conversations on mental health. Let's talk depression. Marianne Bevan, I will turn it over to you now.
Thank you, Mary and Amani. And thank you all for joining us this evening for this important conversation. Joining us this evening is Dr. Abraham Thengam, and I hope I said that correctly, who is not only an MD, but also an MPH, which is a master of, oh my goodness, a master of public health, which I thought was very fascinating, right? He's known as Dr. T to his patients and their families. Dr. T is a board-certified psychiatrist and preventative medicine specialist. Dr. T currently works as an attending psychiatrist and medical director of the Rockland Psychiatric Center, which is part of the New York State Office of Mental Health, and specializes in the diagnosis and treatment of mental illness in young adults. Dr. T, we're going to turn it all over to you. Thank you.
All right. Can you, let's see. Yeah. Can you hear me?
Yes, we can, Dr. T.
Oh, you can. Okay, so and you can see me.
Yes, sir.
All right, so let me share my screen. And I trust that slide is up.
Yes, it is.
Perfect. Okay. Well, good evening, everyone. Thank you so much for the kind words and for allowing me to be a part of this conversation. I think it's an important one. Hopefully we'll have a good dialogue together and kind of learn about this together. And special thanks to everyone. I know there were many people involved in making this happen across the New York State Parent-Teacher Association. So thanks to everyone. So before we begin, a few important disclosures from me. It was somewhat stated in the introduction, but I'm a psychiatrist. I work for the New York State Office of Mental Health, also known as OMH. And though this initiative, this series of talks is supported by OMH, I am not representing the Office of Mental Health today. I'm speaking on my own behalf. And secondly, although I'm a doctor, I am really here solely to provide education about mental health and not to provide any individualized medical advice. So depression is a topic that most of us have heard about. You may know someone that struggles with depression, or perhaps depression runs in your family. The purpose of this conversation is really to focus on depression in young people, in teenagers and young adults. Depression, like any mental health condition, is to some extent taboo or stigmatized. People feel that they don't understand it, and many times are embarrassed to have a mental health problem and keep quiet about it. But as we all know, that's really no way to truly deal with a problem. And all that does is create more stigma. So hopefully we can break that down together a bit this evening and have a good discussion. And perhaps I can also share some pearls of wisdom along the way. So this slide shows a spectrum of color, a spectrum of light. But to me, this is a reminder that no two people are alike, and depression is no different in that. And depression, like many illnesses, exists on a spectrum. Depression presents differently in different individuals, and that's why it's so very important to know what depression looks like and how it can look differently in young people. So in my estimation, our greatest president and one of the most consequential leaders in modern history is shown here, Abraham Lincoln. But did you know that Lincoln himself, based on historical account of his own writings he struggled with depression. And to me, this is very important, because if we can normalize mental health and acknowledge that even the best of us can struggle with mental illness, like depression, it goes a long, long way in breaking down the barriers of stigma and shame, and can help our children speak up and seek the help that they might need. So in advance of this presentation, I was sent a list of questions, really thoughtful and I think thought-provoking questions. And so the way I've tried to organize my remarks is to see if we can kind of go through those questions and answer them as a way to understand a little bit better about depression. So let's start at the beginning. So what is depression? What are the different types of depression? Are there early signs of depression that we can see as parents, as teachers, and as loved ones? So depression, along with anxiety, are the most common mental health problems among young adults today. Up to 20% of adolescents in America will at some point during their teenage years struggle with depression. It's a leading cause of disability in adults and in our children and in our young adults. It can disrupt their academic performance. It can disrupt their social development. And it can, if untreated or undertreated, lead to even more serious consequences like worsening or recurrent depression or even suicide. Depression is clearly a mental health issue, but the more we learn about it and the more we learn about other mental health issues, the more we are learning that depression is actually a biological issue. In other words, you don't get depression because you're weak or defective or somehow flawed, but instead because there are biological and chemical changes that are occurring in the brain that contribute to depression. As you may know, there are several different types of depression, including major depression, bipolar depression, depression with anxiety, and even depression with features of psychosis. The bottom line is that depression is a scourge, and we will talk about why it's so difficult to deal with, and also talk about how we can all work together in that. So this is Dr. Google, which many of us lean on as a source of medical advice. Thankfully, there's no need for Dr. Google today. Dr. T is going to walk you through some important information, including what are some of the early signs of depression that parents or caregivers or teachers can look out for. So there are many, many signs of depression. Let's kind of go through each one. When I spell them out for you, they're all going to sound more or less simple, but that's actually far from the truth. Some of these symptoms of depression are actually quite difficult to differentiate. So the one I think that everyone knows and thinks about is sadness, right? The obvious symptom. So crying, sulking, looking upset or desperate. But unfortunately, it's not always that simple. Many young people that are depressed may actually not exhibit sadness, difficulty concentrating. So this symptom is usually manifested in the form of either grade slipping or homework or assignments not being done on time, or a general lack of interest that the youngster is showing in school. And then there's school avoidance, which many of us have thought about and talked about and heard about. So once the symptoms of depression, or frankly, for that matter, anxiety or ADHD or substance abuse problem starts to set in or surface, it's common for the young person to not want to go to school or to avoid school and to avoid school work. Then there are physical complaints, which can actually end up being a symptom of depression. So aches and pains and other physical complaints, of course, should be checked out by a child's doctor, by their pediatrician. But if all else checks out, meaning if the medical doctor, the pediatrician says, I hear the complaints, but I can't find any evidence of any actual physical issue, please also consider whether depression may be the cause of the physical symptom that your child is talking about. Sleep issues, which I'll talk about at some length in a minute, can be a significant symptom of developing depression, but also once you are in a depression, our sleep, generally speaking, gets worse. Irritability, which again, is not so easy given all the changes that your child may be experiencing both physically and mentally. But if they're more irritable than usual, that may be a tip-off as a parent or loved one that a depression may be looming. And substance abuse, which we will address in a few minutes as well. So that said, what are some of the risk factors for depression in youth or in young people? So in other words, what might predispose a teenager or young adult to depression, or what might push them into a depression? So I like to break this down or think about it in two ways. One, there's the stuff that we cannot change as far as risk factors are concerned. And then there are risk factors that we can modify or change or work on together. So either way, it's important to be aware of what the risk factors are. So let's start with the stuff that we basically have no influence over, meaning we can't change this stuff. So on the slide is shown a picture of a pair of blue jeans, which is meant to make me think about not those genes, but the genes that are on the inside of us, that is genetics. So if you, the parents of a child in particular, have a history of depression or anxiety, well, your child is at some risk of developing either of those conditions. We don't fully understand the exact risk, but suffice it to say that it puts your teenager or young adult at some risk of developing depression during the course of their lifetime. The second risk factor that we can't do much about is a personal history of depression, meaning that if your child has had a history of depression or a depressive episode, they are at risk of developing or having another depressive episode. So to be very exact about it, 20% of teenagers that have had at least one past episode of depression are likely to have another one within a 2-year period. And 40% of teenagers that have had at least one past depressive episode will have another one within 4 years. The lesson here is that if you've had one past depressive episode or depression in the past, that we need to be very vigilant and we need to watch out for and treat any subsequent episodes. So that's sort of the not so great news, the stuff that we have very little to no control over and can't change. But what about the risk factors we have some influence over to potentially change? The first one is substance abuse. So alcohol and cannabis being among the most commonly used substances that not only put young people at risk for depression, but basically put you at risk for just about any mental health condition. Moreover, these are risk factor for other issues such as suicide or death by overdose. Then there's what we call the co-occurring conditions. That is having any history of any other mental health issue, as I said before, like anxiety or PTSD, or a past history of depression, puts you at risk of developing depression once again. And social media, screen time, these can be risk factors for youth depression as well, which we'll get into in a little bit more depth in a minute or two. So stress, this is a huge deal, is a risk factor. And stresses include the obvious things like bullying or stress at home, but can also include some positive changes, like if your child is all of a sudden now taking honors classes or AP classes, or has a new romantic relationship as a teenager, or is grappling with their gender identity, or they move to a new school environment. But also the stressful events that we commonly think of, the divorce of parents, issues in the home, death of a loved one, etc. So on this topic of stresses, there are many, many other higher level stresses that we all worry about. Poverty, food insecurity, hunger, family instability, trauma. And as you would expect, all of these can contribute to depression in young people. And as you might also assume, part of the treatment of depression would be to reduce those stressors. Some of that, of course, can't be done alone. Certainly a child or teenager won't be able to solve all of those issues. And more often than not, neither will the therapist or doctor or teacher. When there's such a kind of complex issue, a major issue in the family, like trauma or abuse, or an issue of social stress like poverty or food insecurity, we need to take an all hands on deck approach in terms of how to help. So the bottom line here is that depression isn't going to get better unless we help with the underlying problem once we identify it. So to come back to the precipitating factors, as I said, we'd talk a little bit more about sleep. So what about it? How does sleep impact depression? And can we talk a little bit more about depression and sleep deprivation in adolescence? Sleep deprivation is actually a crisis. It's a problem across all ages, in teenagers and in adults. And as parents, we know all too well, we have a lot of demands on our time each day. And for most folks, teenagers included, sleep is often one of the first things that gets sacrificed because there simply isn't enough time to get all the stuff that you need to get done on a day-to-day basis. Teenagers need sleep. I know that sounds basic, but that is very, very important. Your circadian rhythm, meaning the biological rhythm of your brain that tells you when it's good to wake up and when you need to be asleep, starts to change when someone becomes an adolescent. Essentially, once you hit puberty, you need more sleep because your body needs more sleep so that it can grow. So sleep deprivation has many causes. As I said before, we all know it. Competing priorities make it at times feel like there almost just isn't enough time to sleep. Social media is also an issue with this. There seems to be a link between screen time and social media use and problems with sleep. Basically, the more that you're on these devices, the less sleep you'll get. And that is a problem. To put it more scientifically, not getting enough sleep can also directly increase for depression. You are 4 times as likely to get depressed if you don't get enough sleep. It's that simple. So the bottom line, again, for all of this is that the less sleep you get, the more that it impacts your energy and the more that it can impact a child's performance at school and their mood. So the advice for us parents is guard your teenager's sleep fiercely. Guard your child's sleep routine fiercely. Help them to set a healthy, but also realistic bedtime and then to stick to it. I also mentioned that substance abuse is a risk factor for depression. So how does substance use affect youth that are experiencing depression? So clearly, substance use can be the stressor or a catalyst for a depressive episode or anxiety. And again, when a young person starts to use or abuse substances, so think alcohol or think cannabis, it can lead to depression If they've already got depression, it can worsen the depression. And it can actually make it harder for doctors and therapists to treat the depression, meaning if someone is depressed and they start using, it complicates everything and it makes it harder to treat. So we know most of the reasons why people, and that includes teenagers, use and abuse substances. Like, to be honest, it's fun. Stuff is easy to access. And maybe most importantly, when you're suffering and it seems that there's no other way out, trying to use a substance can feel like one of the only things that you have control over to be able to help yourself. So in therapy, we call that a maladaptive coping mechanism. And you may have heard of it said another way, which is self-medicating with drugs and alcohol, where really what the child or person needs is treatment of the depression that's underlying all of that. So that was, what is depression? What are the symptoms of depression, including sleep? And what are the risk factors for depression, including social media use and substance abuse? Now, all that being said, how is depression typically diagnosed? For starters, we do not use a cookbook approach to diagnosis of mental health issues. So this depicts the famous chef, Julia Child. And if you know anything about Julia Child, you know that she didn't just use the cookbook, she made cooking seem enjoyable, as almost as it is an art form. And just like the professionals will work with your family and your child as an individual to figure out exactly what is going on, to help you and your child understand where on the spectrum of depression your child may be. So if you think that your child or young adult has depression, get them to a professional, period. Doctors, which includes their pediatrician, their psychiatrist, get them to a social worker or a school counselor. They can and will be able to diagnose depression. And that's the first step. Parents, again, don't put that responsibility on yourself. Your job is to be the parent. Our job is to be the professional to help diagnose. Get them to us as you can, and we will work with you hand in hand. We're trained professionals, and an important part of what we do is not just determining whether or not your child has depression, but it's also to make sure that they're not dealing with something else, i.e., is it anxiety? Is it ADHD? Is it a substance abuse problem? Is there some trauma that is going on that's making it look like depression? Many of these issues often get confused with depression and need to be teased apart in order to be properly treated. Lastly, the word depression is used in our day-to-day language very loosely. That line at Starbucks was way too long, and I was so depressed, I couldn't get my coffee right away. Okay, maybe, but the kind of depression we're talking about here is symptoms that persist, sadness that persists over the course of many, many weeks, that usually impacts the way someone behaves and the way someone functions. So brief episodes of sadness or disappointment may actually be normal and probably are not depression. So how can parents and caregivers and teachers recognize the early signs of depression in adolescents and in teenagers and in young children? So this is going to sound a lot easier than it actually is. The answer is simply to talk to your kids and listen when they talk to you. That's easier said than done. If you've ever tried talking to a teenager, and I assume most of you have because you're in this conversation with me, it can be very challenging at times. And you have to meet people where they are, and you have to understand them. So teenagers of every generation, including our own generations, have their own lingo, their own slang, skibbity, sigma, riz. If you know what any of that stuff means, you're better off than me. But also you are ready to have a conversation with a teenager. But even if you don't know what any of those words or slang means, just be honest with your child and have a conversation about mental health. There are a lot of data recently wherein school-age children, teenagers, and adolescents are asked about what they would like to learn about in school and from their parents with respect to their health and well-being. And one of the top things that comes up is adolescents and teenagers really want to have conversations about mental health. Believe it, they are ready. We just need to do our part in starting those discussions. So again, no one, and I'll repeat that, no one knows your kids the way you do, parents and grandparents. That's a lot to take in, but simply put, the earliest sign of depression is a change from what your teenager usually does. Were they a good student whose grades suddenly dropped? Were they a very gregarious and friendly kid who now is more quiet and isolated? Are they irritable and moody all the time? You might say, Doc, that's not easy to figure out. Puberty and adolescence is a time of great change. Hormones are raging, they're growing into their bodies, they're becoming more independent, and they're trying to figure out their own place in the world. That's hard enough, but noticing changes in their behavior and their personality are actually really big keys on cluing in to whether or not depression or any other mental health challenge is brewing. That said, what are the treatment options for depression in youth? Are there differences between the treatments that we use for adults and for young people? So the good news is there are many, many effective treatments for depression. Of course, we've all heard about medicines for depression, antidepressants. They are generally safe and approved for use for the treatment of depression in childhood and adolescence. If you didn't know, these same medicines are actually very helpful for anxiety and trauma-related disorders, and that includes all types of anxiety, like panic disorders and social anxieties and different phobias. Now, psychotherapy or talk therapy is the other, and by the way, very, very effective treatment for depression. So as we understand at present, combining both treatments, medications, and psychotherapies as needed seems to be the most effective, but most cases of mild depression or moderate depression, and again, that needs to be properly diagnosed and teased apart by a healthcare professional, can actually be effectively treated with therapy alone. So, what if there is more than one issue? Now, we certainly don't exist in a vacuum. And so what if a child has depression and another mental health condition, for example? So how can we treat so-called co-occurring conditions, such as anxiety or ADHD and depression in youth? That means usually where there is depression, there is anxiety or something else going on as well. Generally speaking, when a youngster has ADHD, and I'll use that as an example, that should be addressed and treated separately. Generally speaking, with stimulant medications or other behavioral treatments for ADHD. Anxiety, as I've said a couple times already, often goes hand in hand with depression, which means oftentimes that treating the anxiety can actually help the depression improve and vice versa. That said, sometimes these two can be very difficult to tell apart. And again, an important reason to get your child to a healthcare professional who can tell the difference and then offer the appropriate treatments. Anxiety also, important to note, can be treated with psychotherapy as well as quite effective, and also with medicines as needed. So another very important question that's come up is, can you speak a little bit to the long-term effects of untreated depression in adolescence, and how can early intervention change the outcome? Meaning, what happens if you don't treat the depression, if you let it fester, so to speak? The most common long-term effect of that is simply that the depression continues to get worse and worse, as one would expect. And like most medical problems, the longer it goes on, the harder it is to treat. Address the issue early. I've alluded to that several times. So again, if you notice a change in your child or in your adolescent, say something. Hey, what's going on? Something seems different. I'm worried about you. Please tell me what's going on. Let's get some help for this. Let's do this together. So early intervention is the name of the game. Figure it out early, get it treated early. And by the way, this not only goes for depression, but for anxiety, for ADHD, for substance abuse, for bipolar disorder, you name it. Early intervention can actually save so much needless suffering. I mentioned this briefly before, but what about social media? What role does social media play in all of this? And can you talk a little bit about the impact of social media and technology on depression in youth? So let me start with a caveat. As much as sometimes I am tempted to do this, I am not going to lay the fault of everything at the feet of social media. There's no doubt there's a lot of good that comes from using social media, but using social media responsibly. So that's the key. That said, there's more and more evidence that continues to mount that shows that social media consumption, meaning not just among kids, but among adults as well, contributes to poor sleep. You ever heard of doom scrolling? You see a negative story, and then somehow the brain gets hooked into scrolling and scrolling and scrolling and scrolling. And before you know it, you wasted a lot of time in some internet black hole. Poor self-esteem can be a result of overconsumption of social media. So surprise, surprise, right? So looking at all those fake, beautiful, airbrushed photos on Instagram is not going to improve anyone's self-esteem. And then lastly, plainly, social media can contribute to depression. I don't think that it's any coincidence that the rates of youth depression have been on the rise, not just in our state, but across our country since roughly 2012. What happened in 2012? Instagram and some of these other platforms came online. Again, I'm not laying it all on the feet of social media. There's enough blame to go around, but it's something that as parents, we absolutely need to be on top of. So how do you do it? Well, limit your child's screen time. Encourage them to be physically active, which not only keeps you away, hopefully, from social media, but it's also a protective factor against depression, just like eating well can be. And then engage them in conversations about the stuff that they look at and consume on social media. Showing shared interest with your child, especially with your teenager, can go a long way to opening all sorts of conversations, including difficult ones like about depression or anxiety or suicide or bullying. So to bullying, what are some warning signs of depression if a child is being bullied? Make no mistake about it, bullying is a national crisis. And let's not forget that as awful as it is to be the victim of physical bullying, cyberbullying, that is getting bullied vis-a-vis social media, is real. And it's a real problem in our schools. We mentioned school avoidance can be the result of bullying. And school avoidance can be a sign of depression. Withdrawing from activities that they usually enjoy, including stuff that you guys do as a family. That could be a sign of worsening anxiety and depression and of being the victim of bullying. It's embarrassing to the child who's the victim of bullying to say anything about it. But while they suffer silently, depression could be brewing. Anxiety certainly could be brewing. And then before you know it, you have a real crisis. Look, I get it. Depression, like the picture in this slide says, is scary. So this is actually a photo taken from the inside of an adolescent psychiatric hospital from years ago. And some child had scrawled that on the blackboard. And to me, that was very touching. It's scary to go through this. It's awful at any age. And can you imagine when our kids go through it? That begs the question. So how can family members or friends best support somebody who's experiencing a depression? So aside from all of what we've talked about, encouraging good sleep, setting limits on social media and screen time, having open and honest conversations with our kids about depression. So the most important way we can support our teens through depression is simply by working together to reduce the stigma of depression. For some reason, and this is obviously not a new phenomenon, we tend to think of medical and psychiatric or mental health problems as so very different. Like, think about it. Would you ever tell a kid who has a broken arm, just get over it? We'd never do that. Yet many think that that is an appropriate kind of response to a mental health problem or an emotional problem. They are just as serious and dire. So yes, there are cultural or societal stigmas around mental health that prevent young people from seeking help for depression. The question is, what can we do about it? So breaking the stigma of mental health is a public health problem. And I firmly believe that this is something that needs to start in our homes. To the extent that you can, be open with your children. I hope that is coming across as a theme of this talk. Tell them in the appropriate way what you struggled with at their age. If you struggle with a mental or emotional issue at some point and how you dealt with it, or even how you wished you dealt with it, normalizing mental health will go such a long way in removing the awful stigma that ultimately prevents our children from seeking the help that they need. Now, sometimes young adults and families are afraid to seek mental health care for fear that stigma will follow them afterwards. The question there being, how can we remove this fear of being labeled in your medical record or in your community or after seeing a mental health care professional? So again, just being honest, first things first, right? Labels are real. We are labeled, fortunately or unfortunately, in just about all different spheres of our lives. So I'm not going to sit here and pretend that this isn't something that happens. It is. But that said, in New York State, mental health treatment, meaning what you say to a mental health professional and the treatment that you obtain from a healthcare professional, all of that is confidential. Yes, if you're a child, a teenager, a minor, your parents or your guardians will be involved in the treatment. But that's generally the extent of it. It should be a trusting relationship with a professional that's going to keep things confidential and help you. And we as healthcare professionals take confidentiality very, very seriously. The other part of this issue, the concern about being labeled, I think again stems very much from the very real stigma around mental illness. If mental illness wasn't so stigmatized to begin with, then people would be far less worried about the labels to begin with. We have to continue to work together on changing that. And the best way to do so, again, is to normalize mental health care treatment. The stigma approach to all of this suggests that you are somehow weak if you have a mental health problem. I believe that to be quite the opposite. Seeking treatment, trying to get better, actually makes you more brave. It makes you stronger. And so we've discussed depression, its symptoms, its risk factors, the treatments. So what about prevention? Another area of interest and expertise for me. What kinds of preventive measures can schools or families and communities take to reduce the risk of depression in youth? Meaning, how can we do better? First, be proactive as much as you can as parents. I encourage all of you to check out and look into community resources, community-based organizations. Look at NAMI, which is the National Alliance for Mental Illness. And it exists for those that struggle with mental health problems like depression. And it's also there as a resource and support for families. They can be an incredible resource. And of course, initiatives like this one run through our very own New York State Parent-Teacher Association. They can be a great source of information and support. Lean on these wonderful resources that we have in our communities. Work together with your communities, with your schools, with your teachers, with your PTA, and work with other organizations. Get active in the community so much as you can. And together, I am convinced that we can make a real difference in the mental health of our children. So with that, I want to say again, thank you for the New York State PTA for having me, allowing me to share a little bit with all of you. And I'll turn it over and we can open it up for questions.
This was incredible. Thank you so much.
This really was. I have to say, I learned a lot, and I really love the way that you presented in a way that we could really understand. Because oftentimes we speak to a professional and we don't speak the same language.
I have to say that I absolutely love the topic about ending the stigma. That's so huge because there is such a stigma associated with it. And like you said, it's an illness. We don't treat other illnesses like that. Why are we treating this like that? One of the questions I had for you, Dr. T, goes back to when you were talking about the children and social medias and their phones. So we all know that gets pretty addictive. It actually is almost I guess it is an addiction. Can you suggest ways for families, for parents to start breaking that addiction with their children? I mean, I know a lot of us adults are guilty of it too.
Yeah, no, absolutely. Look, I could give a whole talk about social media. I won't, because it'd be in a way beating a dead horse. And look, we as parents, I think I certainly will speak for myself, have been guilty of, I want 5 minutes to myself, and I'll say, just go on your phone, and do your thing. And I think, we all suffer from that in some ways. But in terms of how to break the addiction, I think there's 2 or 3 things to consider. One is modeling. Our children are watching everything we do. So if they see us, hooked onto our devices, what more do we expect from them? So I think being very conscious about what we model is very, very important. That's number one. There are many things, and I don't want to belabor the point, but I would say the second and most important part of this is introduce, if you can, family time and be very explicit about this is our family time. In my house, we're eating dinner together, no phones. This is our time to have a good old-fashioned sit-down family dinner. And so it may be small interventions like that we can introduce into the family situation that actually make a big impact.
Thank you.
I have one. Can you discuss some ways that we can identify real risk factors for suicide, and what are some kind of simple approaches that one can take if they suspect a peer or a loved one is at risk?
Oh, what a wonderful question. So 25 years ago, when I started doing this work, the approach was very, very different. Maybe some of you know this. And it used to be more or less, if you think someone's suicidal, don't say anything. You know why? Because if you say something about suicide to someone, even if you're loving and concerned about it, you're going to put the idea in their head. So don't make it worse. So what did that do? It actually made things worse. So now, to answer your question very simply, we be as direct as possible. Right? And you can preface it with something that is caring and genuine and loving. Look, I'm really worried about you. I care about you. I love you. And I'm worried that you might be in a position where you're desperate and you might be thinking of killing yourself. Can you please tell me what is going on? Have you had any thoughts about harming yourself or killing yourself? Please tell me. I mean, it's as simple as that. It's obviously very, very difficult to have that conversation. That's one part of it. The other part, of course, is having a sense of who it is that is at the highest risk of suicide. And I know you'll have separate discussions around that, but primarily anyone, adult or child, by the way, that has any history of any mental health problem has a risk for suicide. But the number one over and above that is a prior history of a suicide attempt. So someone's that's tried to cut themselves, right? Someone that's had even a more serious or severe suicide attempt is at highest risk. So it's asking the question in a very direct way, but also thinking about who am I asking it to?
Thank you so much.
Thank you, Dr. T. A question I have for you. Oftentimes, we know there's a shortage of counselors and therapists right now. It's a very scary shortage. When parents are really trying to get help for their child and they're running into that brick wall that they can't find anybody, what do you suggest they do?
That's such a important question, because the truth is, I'm a psychiatrist and I love my job, but we're in short supply. We're in high demand, but we're in short supply. So not every child, unfortunately, that has depression or symptoms of depression or any mental health problem is going to be able to get to see someone like me. I wish it weren't the case, but it is. So I think there are a couple of things that we should always consider. One, pediatricians. Every child should have either a nurse practitioner or a pediatrician that manages their well-being, their vaccines, their well visits. Those are the gatekeepers. They are the first step. So if you are having trouble getting someone to listen to your concern that your child may be suffering from depression, call the pediatrician and say exactly that. Look, I'm worried. Can we please have a conversation about this? That would be step one for me. Step two is, if that doesn't work, try again. And I'm serious. Make them listen, right? Your word counts for a lot. And as someone who trained in pediatrics before he became a psychiatrist, believe me, parents' words are number one. That's two. Three would be to call upon your county health department. A lot of people don't think of that, but those are great resources. So I work across multiple counties, in Rockland County, in Putnam County, Dutchess County, Orange County, Sullivan County. Those are the counties where I have clinical work and responsibilities. And I will tell you, across all of those places, the county health departments have dedicated divisions of child services that are more than happy to give you information about where to go, because everyone recognizes how important an issue depression is. I hope that helps.
Thank you.
I have another one. What role does diet and exercise play in managing or preventing depression in young people? And are there lifestyle changes that can reduce the risk?
So the short answer, I'll give you the short and the long answer. The short answer is yes. Nutrition and exercise absolutely help. I coach youth sports, and I tell kids all the time, it's a simple formula. The more good stuff you're involved in, the less bad stuff you get into, right? I don't mean to be reductionistic about it, but it's just that frankly simple. The more complex answer is nutrition and exercise not only prevent depression, they can actually help in the treatment of depression. So I didn't get into this in the talk, but psychotherapy for depression is quite powerful. It's quite effective. Part of psychotherapy for depression is actually something called behavioral activation. Even if you feel down in the dumps and not like doing something, forcing yourself to engage in some physical activity, minimal it may be, can actually help lift you out of medications, out of depression. And it has been shown to be almost as powerful as medication. So think about that, right? And proper nutrition, of course, we know is not only tied in with depression, but also with anxiety and ADHD, medical conditions, proper growth and development, right? So there's a lot to be said for being able to eat right and introducing some exercise into one's life. And, oh, by the way, the more you do of that, the less inclined you are going to be to engage in a social media addiction. And there's data around that.
Excellent points, doctor. And it's true. Everybody knows, like, it's almost like the runner's high. You feel better, you get the endorphins going, and it really does make you feel better. What are the easiest ways for parents to tell if their teenager is just being a typical moody teenager or if they're actually depressed?
That's a great question. I wish there were an easy answer to that question. There really isn't. I alluded to it in my remarks, which is as a parent, you have to trust your gut. Okay, I'm a dad, not a mom, but mom's intuition must always be trusted. If you feel that something's not right with your child, your teenager, go with your gut. Okay, if that means that's the feeling that then prompts you to have that honest conversation, that maybe then gets you to the pediatrician or the next step, absolutely, go from there. So that's I think one sign. The other thing that is very important, and again, I'm not asking moms and dads to be doctors or therapists, but depression, major depression as we call it, or even more moderate or mild cases, the symptoms must last for many, 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 many days. Typically, clinically, we use 2 weeks as the benchmark. So, someone can come home moody and be moody for a weekend or irritable for a couple of days and it gets better, right? That I wouldn't necessarily make too much out of. But if it's on the order of a couple of weeks, absolutely. That's one. Two, we talked about this before when Maria asked her important question. If suicide is ever a concern, it does not matter how many days it's been going on for. The mention or concern about suicide is an immediate trigger for a mom, a dad, a teacher, a counselor to seek additional interventions.
Can I ask, I know, Maria, we're bouncing back and forth, but I just wanted to ask a question back on the suicide discussions. And I know we're doing another webinar in the future on that, but what about the myth that people who are going to commit suicide don't talk about it, or they don't show the signs, or is that true? You see that a lot where people don't see the signs. And we had a couple of suicides in our district a few years ago, and that was the thing we went through. Our superintendent didn't want to talk about it because he was afraid that talking about it would encourage the other students to do that.
Look, so I'll say two things about it. One, you're absolutely right. It's a myth. It is a myth. We need to start having open and honest conversations about suicide, period. Right? That is the only way to get ahead of this that I'm aware of, or that I can think of. So I think I understand why people are nervous to have those conversations. Because of that fear. And to be true, there is such a thing as copycat suicides. If you can remember back a little over a decade ago when Robin Williams passed away terribly by suicide, there were a rash of people that did kill themselves in the wake of that. Was it because of him, or because they were struggling with depression and were thinking about ending their life anyway? There's no way to do anything around that. That all said, just to answer the first part of the question, which is, are there signs and are we not seeing something? And I would submit to you, it's not that we don't want to see, it's that we don't know what we're looking at, right? And sometimes the signs can be very subtle. I mean, the examples I gave in my talk were sort of dramatic, right? Like, the class president, the most gregarious person, all of a sudden isn't talking to anyone. Yeah, that's pretty obvious. But often the changes are more subtle and need to be kind of thought about and picked up. And look, we all get wrapped up in our day-to-day lives, and it's impossible to kind of see every little change that happens with our child. So I'm not putting too much on anyone, including teachers, but engaging with your child on a regular basis such that you can pick up on these subtle changes, to me, is the way to do it. The other important part, to the extent that you and your family feel comfortable doing it, is to monitor their social media activity. There may be subtle signs that you may not be seeing when you look at them or speak to them, but may be posted somewhere on social media. So there's a lot to think about there, but it absolutely is a myth.
Thank you.
See, we knew it. We needed a professional to tell us. Dr. T, can you end our evening off with some tips for families and community members that would encourage an open dialogue with their children and teens about this very important subject?
Absolutely. I have a lot of tips, but I'll give you the one that I think is the most important, right? I mean, and I teach young doctors and nurses all the time about a lot of this stuff, but we've been talking a lot about trauma lately. And I have a saying, which is, when you first meet a patient, you don't say, "Hi, I'm Dr. T, tell me about your trauma history." That doesn't work, right? People have to have trust in you before you can have those hard conversations. And it actually won't seem so awkward to have those hard conversations. So I think the best way, especially as parents, let me just focus on us as parents, the best way to have these conversations is to have regular conversations about everything with your child, right? It could be the car ride home, it could be dinner time, it could be while you're sort of rushing them out the door, 2 minutes before you get them on the bus, right? Having those everyday conversations about how their day is going, what's going on, what's interesting to them, engaging a little bit with them in their hobbies, in the things they love, especially as they become teenagers, right? I mean, we suggested this before. It's normal to not want to talk to mom and dad all the time. It's normal to want to, flex and branch out a little bit. So again, I think the best way to have the hard conversation is to have a lot of easy conversations before you get to that one. I hope that makes sense.
That was actually wonderful. I love that.
Dr. T, we want to thank you so much for joining us tonight and having this conversation about depression. I know I speak for myself when I say I wish I had met you years ago when my children were younger. It's been so informative and so easy to understand. You really broke it down for us. Thank you.
My pleasure.
Thanks. Now I think it goes off to me. So thank you again, Dr. T. This was wonderful and very helpful. Hopefully this webinar has helped you all to better understand depression and to aid in opening a mental health dialogue in your home and giving you some tools to help. Please look for our next webinar where we continue to discuss and expand on our discussion about suicide. Thank you all and have a good night.